Good morning to all of my wonderful colleagues who are working so hard on the Committee of Rural Health to find optimal healthcare partnerships addressing the behavioral healthcare needs of those living in rural and frontier communities. Thank you for your important and prodigious work. As a young girl sitting at my grandmother's feet, I heard about those slithery snakes, and the raucous pigs, the welcoming neighing of the horses, and the cool summer nights that she spent in the barn, sleeping in the hay with the animals. There were also the emergency visits to the doctor miles away by horse and carriage, and the frightening shouts of the men on horseback coming ever closer, threatening to burn the farms that provided a sharecropper's home and work for my grandmother's family and other Jewish families fortunate to have felt a stability in the Pale of Settlement, now partially known as Ukraine, in the late 1800s and early 1900s. Soon enough, my great-grandfather in 1907 left his home and his family in Russia to build a new life for them in America. On November 11th, 1911, my grandmother, who was then just 13 years old, arrived at Ellis Island with her mother and 3 younger siblings, homesick for her rural life in Ukraine and anxious but hopeful about the architecture of her future life as the family would soon reunite on the Lower East Side of New York City. From my grandmother and my grandfather, my mother and my father, and my large extended family, I learned about the Jewish ideals of a loving commitment to family and to social justice in our larger society. Rabbi Hillel's maxim, if you're not for yourself, who are you? If you're for yourself only, then what are you? And if not now, when? Was the foundation of who we were as progressive Jews in 20th century America. After hearing about my uncle's work as a clinical psychologist, I determined at the age of 5 that I would become a clinical psychologist. As a college student in Princeton University, having become increasingly aware of the power of the courts and legislation in shaping human behavior, I aspired to combine a study of the law with my beloved science of psychology. In the first women's class of 1973 at Princeton, we demonstrated the importance of the social activist's voice. As the first woman to be president of residential college, advocating for student rights and the larger community's use of our abundant campus resources, and as a summer intern for Congresswoman Bella Abzug, I was part of the women's movement and student movement that demanded social justice for all who are minoritized, marginalized, and targets of hatred and violence. In 1977, I created the Victim Witness Assistance Unit in the State Attorney's Office in Tallahassee, Florida, to assist violent crime victims and witnesses in the criminal justice system. In 1978, I co-founded and became the first board president of Refuge House, a shelter for women and children survivors of domestic violence. Today, both the Victim Witness Assistance Unit and Refuge House have significantly expanded their reach to serve annually scores of thousands of women, children, and men who are survivors of violent crimes. Throughout my career as a clinical psychologist in Chicago and nationally respected forensic psychologist, I worked with domestic physical violence, sexual violence survivors, and was a faculty lecturer for many years at the University of Chicago, the Rosalind Franklin University of Medicine and Science, the Massachusetts School of Professional Psychology, and Northwestern University, teaching the courtroom role of the forensic psychologist. In the early 2000s, I became a national movement leader for prescriptive authority after having been elected president of Division 55 in 2004. I was then president of the Illinois Psychological Association in the 2010s and led the successful legislative movement for Illinois Psychologists' Prescriptive Authority between 2011 and 2014. I'm happy to say that Mary Louise has been a part of that movement with us. Many different community partners joined us during those years. The sheriff of Cook County, Tom Dart, one of our earliest high-profile supporters, has famously said, "I run the largest mental health facility in the country, but for the Los Angeles County Jail." Nearly half of the men and women who are incarcerated in the Cook County Jail are diagnosed with a mental illness, and there's a scarcity of mental health resources to care for these individuals. When I had organized a panel of prescribing psychologists and behavioral health directors of federally qualified healthcare centers to speak to an audience at the NAMI State Conference in Chicago in 2012, the NAMI audience enthusiastically cheered us, even standing up on their seats. They told us that they were excited to learn that there could be more providers of comprehensive integrative mental health care. When I talked with the police chief of one of our more rural Illinois police departments in 2014 as we were lobbying for our prescriptive authority legislation, he first asked me, Why didn't you call me sooner? Then he said to me, here in central Illinois, our officers use their guns maybe once in a career. Yet they train every week at the shooting range and are tested on their shooting acuity every 3 months. But what my officers see every day are members of our community who are suffering with mental illness, are homeless, and have nowhere to go. So our officers have to take them to the county jail. They don't belong there. We need mental health resources. He said, I will personally go to our Illinois state legislature in uniform and talk with the legislators, and I will bring my deputy as well as the sheriff and his deputy. I will call the president of the Illinois Chiefs of Police Association, the Illinois Sheriff's Association, and the Fraternal Order of Police so that they will support you too. In one of our 2014 legislative hearings, a psychologist who was opposed to this legislation talked about how psychologists' jobs needed to work more closely with psychiatrists. One legislator told him, you just want to continue the way things are and have always been. We can't do that anymore. Our system is not meeting the needs of our citizens who are suffering from mental illness. We have to do something different. After our prescriptive authority legislation passed in 2014, clinical psychologist Dr. Lori Rickman Jones, who had served as a senior policy advisor for behavioral health in Governor Pat Quinn's office, wrote to me, just a quick note, Beth, to congratulate you for your work on this historic legislation. You should be commended for your tenacity and willingness to work with the other trade associations to find common ground to make this happen. Most importantly, we will now have the ability to improve access to thousands more in our state who need care. I know that your work here in Illinois will create a pathway for other states likely to follow. In the fall of 2014, I traveled around the state of Illinois and met with hospital CEOs and hospital medical directors, many of whom are psychiatrists, to create clinical training opportunity for our prescribing psychology fellows. Each medical director to a person said to me, I was your most vociferous opponent while you were lobbying for your legislation, but now that it's law, we need you. Let's do this together. And we have. The prescriptive authority movement's mission is to provide care for our communities most vulnerable and underserved, from a cadre of licensed prescribing psychologists representative of BIPOC, API, LGBTQIA+, Jewish and disabled communities. My goal is to have more than 1,500 licensed prescribing psychologists in Illinois by 2044, thereby increasing access to the highest quality mental health care in Illinois by 100%. I continue to consult with statewide prescriptive authority movements throughout the U.S., and I'm thrilled that our movement has spawned successful prescriptive authority legislative successes in 7 states, including New Mexico, Louisiana, of course, Illinois, Iowa, Idaho, Colorado, and our most recent success in Utah. I'm the co-founder of IMPAP, the International Organization of Prescribing Psychologists. We're working closely with psychology advocates who are leading prescriptive authority movements in Brasilia, Brazil, Ontario, Canada, Jamaica, and other parts of the Caribbean, India, Jordan, Nigeria, Poland, South Africa, Taiwan, and the UK. In each state and country, the key factors for revolutionizing the healthcare system by passing legislation that would authorize highly trained prescribing psychologists to provide comprehensive integrative healthcare to those who currently do not have access to it are: 1, support a strong leader and leadership group in their state, province, city, or country to collaboratively lead this initiative, to raise significant funds, work with a high caliber, well-connected professional marketing, public relations, or lobbying group to help you liaise with the state legislature, administrative committee, or other governmental entity that can create and enact new laws. Identify passionate, smart, like-minded governmental officials, legislators, or others who understand the ways in which the current healthcare system has broken down and want to improve access to quality care for the most vulnerable in our communities. Partner with your psychological community throughout your state, province, city, country, governmental entity, and organize your business community around this legal solution to the current mental health crisis. As Mary knows, we partnered with about 640 psychologists in the state of Illinois to get our legislation done. Also, ally with important other third-party groups in your community, including NAMI, law enforcement, powerful religious institutions, large and established social service organizations, medical, counseling, legal, accounting professionals. I've recently completed a book, soon to be published, entitled The Revolution in Healthcare: How Prescribing Psychologists Are Changing the Landscape of Mental Health Care in the United States. Jared Skillings, whom I cite in my book, sees prescribing psychologists as the perfect exemplar of the effective disruptor. Just as Ubers and Airbnbs did not exist 15 years ago, he says, psychologists having prescriptive authority has not always been a choice for psychologists or their patients. He extols prescribing psychologists by noting their uniqueness. This is a disruption, he says, with increased training, increased quality, and therefore increased practitioner value. A departure, Skillings notes, from other disruptive organizations or movements that have brought quality down. Because of the significant increase in training, Skillings sees psychologist prescriptive authority as the one practice specialty area which is exclusively reserved for doctoral level clinical psychologists. Psychologists, because of our extraordinary education, training, and experience, have an impact every day on the lives of those who are suffering in our local, national, international communities. I wholeheartedly support the critical work done by applied and clinical and academic psychologists, and I passionately believe in protecting clinical practice while seeking to expand practice to include prescriptive authority, integrated behavioral health, in a variety of healthcare and medical settings, telehealth durability, community mental health, population health, and a plethora of collaborative intersectional relationships among research scientists and scientist practitioners working on ways to achieve health equity and dismantle systemic racism and all of the other hate-based inequities in our healthcare system. My vision for the APA has 7 foundational pillars of action: identifying and disseminating the critical information specifically on evidence-based, evidence-informed treatments for the sequelae of COVID-19 and the substance abuse and addiction disorders, using our effective scientific evidence to contribute to the eradication of global health disparities, the dismantling of systemic racism and anti-Semitism, and the achievement of health equity, promoting global initiatives that will reduce the existential threats to our environment and will meet the challenges and needs of climate refugees, facilitating greater access to comprehensive integrative mental health care, including prescriptive authority, promoting clinical practice and working closely with SPTAs to ensure that they have the necessary tools to address developments in state legislatures that might erode the privacy rights of patients and or erode the psychotherapist's privilege. I will ensure the financial viability of our APA SI, emphasizing the critical importance of scientists and psychological science infused with DEI initiatives, fulfilling our APA mission to impact our world, providing for the continued growth of an inclusive APA that ensures multidisciplinary within psychology, multicultural, multinational APA leadership with representation from all minoritized and marginalized communities, including BIPOC, Jewish, LGBTQIA+, AAPI, and disabled communities. The training of the psychologist will continue to undergo refinement. Both psychiatrists and psychologists are recommending a streamlining of the education of the prescribing psychologist, the clinical psychologist, and the psychiatrist. Our communities continue to cry out for higher quality, compassionate, accessible, and comprehensive integrative healthcare. We are engaged in the growth of telehealth, the use of big data, the explosion of AI, the increasing significance of the role of the prescribing psychologist in primary care and primary prevention, the discussions of the role of the psychologist in creating transformative change and acting as a disruptor. As our CEO, Arthur Evans, has predicted, our youngest generation of psychologists must be trained to work in ever faster paced, complex environments with diverse populations. It will be psychologists who will be on the front lines of change in our rapidly moving healthcare landscape. As your president, I will walk courageously with you into our future. I will listen to you with respect and compassion and govern boldly. My outreach to all of our many communities will be collaborative, intersectional, with an emphasis on scientific evidence, bridge building, equity, diversity, inclusion, gender and sexual diversity, and working to unravel and solve our world's toughest challenges. I said of my father at his memorial service, this little boy who became the man with the twinkle in his eye had quiet dignity and wisdom, the respect of all who had the good fortune to meet him, and the love of all who had the good fortune to know him. I hope that you will think the same of me.